Starting therapy can feel like you're stepping into the unknown, especially in your first session. You don't know what to expect, you don't know what to say, and maybe sometimes you might be wondering if the therapist is judging you. So, I want to clear the air. I'm Dr. Kelly Watkins, a psychologist and CBT therapist and EMDR therapist. And today I want to share the 5 things I wish that every client knew before walking into session 1. So, I suppose secret 1 is we are not judging you or what you would define as your mess. You don't have to tidy up your life story before therapy. In fact, please don't. As therapists, we expect complexity, we expect contradiction and confusion, and we're not here to be impressed by this articulately description of your life. We're here to understand. You can cry, you can swear, you can say, I don't know, 14 times in a row. It's completely normal. You really don't have to be polished. You just need to be honest, and even that can take time. And just know that therapy isn't about performing, it's a process. Number 2, that you can bring your notes or you can say nothing. Some clients will come in with bullet points, some people will come in with reams of paper. Others sit silently before saying a word, and both are completely okay. There's no right way to be in session. If prepping helps you, prep. If showing up with nothing to feel more natural, then do that. As therapists and psychologists, we work with your pace. There isn't any pressure, there isn't any scripts. It's about meeting you where you are. Number 3, you won't scare us. People often are worried that their thoughts are too dark or their past is too much, or we're thinking that they're crazy. That just know that you're not going to shock us. We're trained to hold space for pain, for trauma, for fear, for shame, even rage and just anything else that you can think of. We know how to sit with what you're saying. We're not going to recall. And what feels potentially unbearable for you might be exactly what we're going to be standing alongside you to help you to carry. Number 4, surprising or not surprising, is that we're human too. We have training, of course, and yes, we have boundaries and ethical guidelines and practice guidelines to abide by, but we're also human beings who feel alongside you. And sometimes when you share something deeply painful or really, really brave, we're not going to sit there blank faced, or at least I won't. Because obviously I know there are some blank slate therapists. But for other therapists, that we care and we're moved, and we'll show that within our face. Of course, we won't bring our personal lives into the room, but our compassion isn't just professional, it's personal. We feel things alongside you. So yes, we are trained, but we're also human. And number 5 is you're not behind. A common thing that I hear in first sessions is, I should have come sooner, or I should have come before. Therapy doesn't come with a deadline. You're here now and you're right on time, and that's what matters. You're not behind, or you're not falling by the wayside because you haven't come in before. You're at the beginning and you're right where you need to be, and the beginnings are super powerful. It's never too late to start. It's not that you're behind, you're here and you are starting the process. But to conclude, that starting therapy is brave, but it's also uncertain. So I hope that this maybe makes that first step maybe a little less scary. I've got lots of other videos about the process of therapy, but if there's anything in particular you would like me to cover, then please drop that in the comments section, and even maybe let me know what surprised you about your first therapy session. Please hit like and subscribe, and as always, thank you so much for watching. Please take care, and I will see you in the next one.